Hi, my name is Louise Jones. I'm a captain in the Army Reserves and I'm a paediatric nurse. So I trained as a nurse starting in 1983 and I trained in Oxford, which was then the School of Nursing before degree training was a thing. And then I trained to be a children's nurse in 1989 in Birmingham Children's Hospital. So I decided to try to become a military nurse in 2015. And I'd been talking to my mum and my sister and regretting that I'd never applied to join the army or join the Army Reserves. So they encouraged me to apply, which I did just before my 50th birthday, which was the cut-off for applications, and then surprised myself that I managed to get in. So military nursing, in my experience, and I've worked on operations with NATO colleagues, including from America, from some of the Middle Eastern countries, and working in the military, you're trained to have a much more can-do attitude. You really have to work to get the objective achieved, whatever that takes, with whatever resources you've got. And that attitude that you have and that you're developed to have is really important and quite a different attitude that you develop in the NHS or in different parts of nursing life. So one of my proudest moments is surviving the Sandhurst course and coming out the other side, and despite a couple of times wondering what I was doing and why I was doing it at my age, particularly the physical aspects of it, because most of the other people on the course were half my age and much faster and stronger. But that was a real achievement. The passing out parade was wonderful on the final day. But another really special moment at Sandhurst was when we were sleeping out in the field one night and I was on stag duty, which means you're watching for the enemy in the middle of the night for 2 hours. You have to take it in turns to be the watch person. And just as I was wondering why I was still there and why I wasn't at home in my comfy bed, a deer came across in front of where I was doing the stag and some of the deer's babies. And they just wandered through and off into the mist, and that was an amazing sight. So one of the big challenges that I had to overcome for my training and also now ongoing in the reserves is getting fit and staying fit. And that's something that I work at all the time. It gets harder as you get older, but what you've got to be really careful of is you don't want to be unfit and be a burden to your military colleagues. If, for example, you find yourself in a conflict situation or a humanitarian disaster where you might have to carry something heavy, you might have to run across a field at speed, and what you want to be in a fitness position to be able to help somebody next to you as well as achieving it yourself. So that's it's been a good challenge, but a tough one at times. So the advice I give is to really find out what it's all about so that you know what you would be applying to do and what you'd be committed to do. Particularly around whether there's two routes of entry. There's a soldier entry route and there's an officer entry route. And it's really important you know which is which, because the training pathways are different, the career development pathways are different in the army generally. And then in terms of nursing, I think again it's really important to think about deployments, about the potential for ending up in a war conflict situation, in a hospital in the middle of a desert, or on a ship, or in the air, looking after really, really sick patients. And although you'd go in and you get the training to do that, and you wouldn't be on your own, you have to think about whether that's something that you want in your life, or that you're prepared to work at and develop at and take pride in. I think it's a great opportunity for me personally and for all the others around me that I see are military nurses, but it isn't for everyone. And before you commit, it's important you understand. So a big lesson I learned from nursing in the military was during the NATO exercises that I've been involved in field hospitals in Germany, in Poland, with our NATO colleagues. I really learned the importance of managing the resources you have. So in the NHS, in the world that I've lived in here, you have a lot of resources, you have a lot of supplies, things like bandages, dressings, medications. You have boxes and cupboards and whole shelves full of equipment. In the military, however, and during these exercises, much more realistically, you don't have so many resources, and you have to be much more mindful about how you use things. So, for example, on exercise, whereby in the NHS I'm used to using quite a lot of tape to stick down a dressing, when I've been on exercise, I've realised really quickly that you can't use loads of tape to stick down that dressing. You have to use the minimum amount to make it stick. And that's a small example, but because you haven't got a big cupboard just around the corner, you've only got a box full of stuff, for example, you just have to be really careful. The best thing for me is working with others, making patients better, helping patients, if they're in pain, helping them feel less pain. And as a nurse, generally, including as a military nurse, if you're looking after a patient who is dying, it's helping them to die peacefully, to help their relatives, to support them, so that they have, and it sounds a bit weird, but the best, most comfortable death as possible in sad circumstances. So Florence Nightingale and Mary Seacole's legacies really mean to me strength of nursing, strength of women who had to work very hard to get their voices heard when they were starting out and improving patient care. And not only just being kind and caring to people who are sick and casualties, but working harder than that to make sure that they were treated more safely, that standards were better for them, including infection control. And they worked very much in a world at that time dominated by doctors. And they, I'm sure, had to shout very loudly to be heard and to be influential like they have been. Being a reservist and being a military nurse is quite a difficult balance of managing your time. So having a day job in the NHS and having military commitments as a reservist and having a life can be a challenge sometimes. Again, it's a challenge I enjoy, and I get a lot of support from my family to disappear off for a couple of weeks here and a weekend there, and they're very supportive about that. But time is the challenge. So what's it like being a female in the military? I think we can broaden that. We can look at diversity in the military more generally. So whether it's wherever you come from in the world, whatever your gender, whether you're a woman, a man, whether you're a nurse, whether you're a doctor, but from what I've seen in Army Medical Services, everybody's treated with respect, given opportunities to develop, given opportunities to show what they're made of, and encouraged to develop and get stronger and work together to understand each other's different cultures and different beliefs. So that's what I think.